Today is Sunday, September 25, 2016. This dwarf hamster, female more than 1 year old, had a left ear wart and a left thigh subcutaneous tumour. Dwarf best look at a hamster a day on the average regarding their diseases. Now, many of them are actually subcutaneous lumps, and much depends on the owner. If they have not noticed it earlier, the lumps begin to grow bigger and bigger, as in this case. And many vets do not want to operate because of the anesthetic risk. Now, these hamsters are quite sensitive to anesthesia because of the size, quite small size. And once you get your anesthetic wrong, whether it's isoflurane or injection of Zolitol, they do die. So now we have operated on this hamster. Now we see that the left ear wart has not been taken out completely unless the ear is cut off. So this one we need to ask the owner's permission to cut off the left ear part of it. Now, this left ear wart is best done by electro excision because of the fact that if you use scalpel or scissors, you can't remove it completely. So much depends on the experience of the vet. Now we look at the left thigh tumour, which you will see in the other video. Is about 1.7 centimeter times 1.2 centimeter, and this has been removed. Now, yesterday before surgery, the hamster weighed 36 grams. Now I would weigh the hamster after removal of the tumour. Now I got to wear gloves because sometimes the hamster bites person, and you see it does bite. It's not happy. It did bite me, but from the glove. Okay, now you see what's the weight now. What's the weight? What's the weight? After surgery, it seems to be 32 grams. So the tumor was about 4 grams. 4 grams, and this is quite a big tumor. Now I will show you the operation site. This is about 24 hours after surgery. Now I wear gloves because if it bites me, it just bites the glove. Okay, you see the operation site. You can see the stitches are there on the left thigh. I focus on it. Oh, let me hold the hamster. Now, just to focus on it, you hold this way. You see the left thigh. The left thigh, it did bite me now. I bite the gloves actually. Now the left thigh, the tumor is no more there. No more there, but I'm just trying to show the stitches. There are some absorbable nylon stitches there. And Judy, come and focus for me. I think I asked Judy to focus for me because now you hold the whole thing. Because this lens can't focus. Well, I will hold it. I will hold it. So she can focus on the eye. Now this hamster is not happy with me. Yeah, it just bites me here, but I should change the right hand. Left-handed. I'm right-handed. Okay, take the right hand. And just to show the stitches. Okay, ready? Just wait a while. Just zoom on. It's quite an active hamster. The bite can be quite painful actually if you don't wear gloves now.
I'll hold them.
Wait, no, you better don't hold. Just focus on it. I just need to show only. Okay, I just put here beside the tumor. Okay, wait. There, do you see it? The left thigh here, there? at the left thigh, just to show it's a big tumor. It's more than just focus on, zoom onto it far away. Yeah. I'll just show that the earlier the better. If you can remove, if you spot, check your hamster every day, and if there's a big lump here, so when it's small, it's easier to operate and safer. But I can see it was quite a long stitch. Can you focus on it properly? Do you manage?
Yes, no.
Then click take one photo by clicking the top part. Then no, this part further up. No, the further down, no. Down, further down. There, the button is further down, D-O-W-N, down. Yeah, just see the button there. You put the camera down, you see the button there. There, the button. No, further down a bit. That one, no. This one. Wait. Focus first before you click anything. Focus, then you just snap. Focus first, because it's pretty hard to. I see it biting me again. Yeah. Once you focus, you click, you will come out. Yeah. But you must be focused, otherwise you don't really need to go nearby. But as long as you focus on it now. Okay, finish. Let me see. Switch off here. Okay.
Not yet.
24 hours after surgery, you can see the hamster had the left thigh tumor removed, and now she's biting her stitches, and this is quite common. So we have to give painkillers and also distract her from biting. And you see this hamster is still quite active. You can see that the wart is still there, so we have to speak to the owner about cutting it with part of the ear. Get permission from the owner. Some owners don't like it. You see, he's sort of like doesn't allow me to touch him. Overall, I would say we use Zolotale 100. Yeah, so you need to have a IM and then isoflurane gas. And surgery has to be fast, and the aircon should not be there. And post-op, about half an hour, check the hamster and clean off all the blood, the bleeding, because there'll be some bleeding, and the hamster will lick off all the blood. So it's better the vet cleans up the blood, clears the blood, rather than let the hamster lick it off. Yeah. And also the wound. Now, antibiotics and painkillers for 10 days. You will go home today. Sometimes the owner knows how to give, sometimes they don't know. The father is in charge of this, the mother and the daughter and son are very frightened of the hamster because he bites. And she has bitten them. So the children dare not touch it. You can see the earwart. Earwart is not small, and from my experience, it has to be electro exercise using electro surgery. But the part of the ear may come off, and the owner must be warned first. Yeah. So you go home now, 24 hours after excision of the left thigh. Subcutaneous tumor, it is a grayish in color because of the formalin. We put it into formalin. The owner will not want histology, as that will cost money. So that is how it is, but we still have to ask the owner. Otherwise, the vet has not done his job properly, because if you don't tell the owner, some owners they will want histology to check whether it's cancerous or not. Some owners want the lowest cost. Yeah? So lowest cost, there's no need to send. You can see him biting his stitches. You see. Just distracting. Have you been given painkillers today?
Done morning.
Done. but usually the stitches can hold normally about 7 days. You see his nose a bit black also, the tip of his nose. The best is to wear Elizabeth collar, but obviously this is not practical in dwarf hamsters, and they should not be running around. But call the owner to bring the hamster home.